Hi, everybody. Thanks so much for joining this Community Health Worker Roundtable discussion with Dickson Mbewe, who is an incredible community health worker from Malawi. And we're going to have an opportunity to discuss with him some of the most exciting and cutting-edge developments in the community health worker movement. Dickson, do you want to introduce yourself?
Yes, thank you so much, Dr. Dan. Yes, my name is Dickson Mbewe, a CHW working for the Minister of Health in Malawi, who has been working for the Malawi government for close to 20 years now. So,
Wow.
yeah, in brief, yeah, that's my introduction. Thank you.
That's wonderful. You know, Dickson, I became a doctor 20 years ago, so you and I have seen a few things in our
Yes.
clinical practice. Well, speaking of which, can you tell us a little bit about how you became a community health worker and, you know, what maybe some of the stories that got you into this work?
Yeah, actually, I was inspired by some of the CHWs working in my community. That's my home village. So when I saw the incredible work that they were doing, I was so touched and inspired to do the same. So, for example, they would come in my community to do some vaccinations, nutrition screening, patient follow-ups, disorder tracing, disease surveillance. So I was so interested to learn more about CHW work. So after some time, is when the Minister of Health released an advert for the same. So I applied for that. Fortunately, I was recruited into the system. That was in 2006 now. Yeah, so from that time up to now, I've been working for SHW and in 2015 promoted to be a senior health surveillance assistant, as we are mentioned here in Malawi. So I supervise, I do the actual work in the community, and also I do some assigned duties by my senior supervisors.
Hmm. You know, I've had the opportunity to see community health in Malawi firsthand, and I know the incredible work that you guys do with adherence support for things like TB and HIV, and even treating childhood illnesses through the ICCM protocols. And a lot of community health workers that have been on this roundtable discussion uh, offering work very locally. But you and I have met internationally. We met once in Liberia at the third CHW symposium, and then recently we met in London, where you and I were able to participate in a broader discussion on data and community health. You've become quite an international figure. So, from your local work as a community health worker to now this multinational work, what's that experience been like?
Yeah, it has been a very, the first thing to say is like an honor to me because we have got a lot of such abuse in Malawi. But having that opportunity to go international, it was not a joke, but to me, it's an honor. Yeah, I feel so humbled and also I feel appreciated by those who support me. Uh, you know, all the international travels are sponsored by, most of them are sponsored by CHIC, Community Health Impact Coalition. I've also traveled with the People's Health Movement. I've been in Nairobi for some time. So all these things are done not just for the sake of being a SHW, but for my dedication to duty and also when I want to speak to those donors, funders, I say what is on the ground. So
Mm.
being an international speaker and also SHW has interacted with different donors, funders, and those policymakers, it has been a privilege to me because I've been speaking things that have to be done in the communities. You know, whatsoever we are doing, we are talking of the SHWs to be paid, to be what, to be what. What we need at the end of the day is for the communities to get the most reliable services by the SHWs. They have to get the best services from the SHWs. So when we are in the international meetings like this, we speak what is needed, what donors should do, what funding is needed, what resources are needed, what technical support is needed for the community to benefit. So to me, I see like a way to do and things to be happening that way, because HWs are on the ground. They have to speak for themselves, not somebody to speak on their behalf.
And you bring up a really important point, this idea of nothing for us without us, a phrase that is often used to say why we want community health workers in the room when we're speaking about them. That's a core principle at the organizations that I work in. You mentioned the Community Health Impact Coalition. And I think you highlight, and we can hear already in the things that you've said, that it's not performative. It's not just they're in the room listening to us talk about them, is that there is great truth that comes from people who are closest to the problems. And I think that if we can hear that truth, our programs will get better. So one of the things that has come up is this question of community health workers being appropriately supported. We talk about being salaried, supplied, supervised. You yourself have been a strong advocate for this. The Community Health Worker Program in Malawi has long been a professionalized cadre, the health surveillance agents. Can you talk a little bit about what being a professionalized community health worker has meant for you and how you've seen the movement for community health worker professionalization internationally develop?
Okay, thank you so much. To start with, as a CHW based in Malawi, we have done a lot. As we are talking right now, the Malawi government has done a lot of things to CHWs just because we have been advocating for that. Just to bring you back to that, as the time we were in Liberia, we had the director of community health workers and her second director was there. We had also some official from the Ministry of Health and other supporting partners there. So you remember I had to speak about the CHWs in Malawi. From that period up to now, I can tell you we have seen a lot of progress in regards to community health work is concerned in Malawi. Just in the past 2 years, the ministry has recruited over 3,000 CHWs into its system. And currently, as I'm talking now, it has already released the advert to recruit more than 2,000 CHWs to be put in the payroll for the government.
Wow.
So again, we are talking about the skilled. The Ministry of Health has introduced a 1-year training for CHWs in Malawi. Previously, it was only 3 months. As the one who has gone through that, when I was recruited, I just went through a training of 3 months, then I was put in the community to work. But right now, as I am talking now, the ministry has introduced a 1-year training. The other cohort has just gone to the training to the college the past 2 weeks. I am one of the people who have benefited from that. Last year I was there. I've been trained a year in the community health work. Right now, I know what to do in the community. I know what not to do in the community. I can easily prescribe those conditions in the community. That's the benefit of being an advocate. So to me, it has been a good journey, and I can also applaud the Malawi government for listening from what the CHWs are talking about, because it's about CHWs for them to speak and not others to speak for them. So for internationally, I think I've got a lot to do. But I'm happy to say that in some of the countries, things are moving. We talk of Uganda, you talk of Kenya. Kenya's right now, CHWs are being paid stipends, which was not there before.
Mm.
So through this advocacy, most of the governments now have come in to change their policies, to increase their funding, to change some of the working conditions of CHW so that they can have the better place to work and also to have the good supplies to perform, to provide in their communities. So to me, this advocacy has done a lot, and we are still fighting for more things to happen, and we are sure these things will happen in the nearest future.
That's incredible. And the health surveillance assistants in Malawi, like I said, have long been a cadre that the world pointed to about what's possible with a national at-scale program. But this story you tell about how you can continue to add iterative supports and benefits to make the program expand and grow. I often, in the S's, salaried, skilled, supplied, supervised, I often sort of in my mind skip the skilled because I think always so many community health workers bring skills to the table. We sometimes think, oh, we have to train them in those skills. In myself in working at a medical school, I think about my medical students being built almost from the ground up, first year to all the way to the end of their residency, building their medical skills. But what I've seen is what makes community health workers so special is what they bring to the table. Their ability to connect to the community, to speak their language, to hear and see things that others can't, and also to get access and have the time to get access to parts of the community that really are where disease happens and healing occurs best. So it was very exciting for me to hear you talk about that, and congratulations. I know that you have also participated in efforts to try to create community health worker advocacy programs and maybe even an association. You brought up Kenya, Margaret Odera, who's now, our friend and also an international sort of model for community health worker advocacy. You and I had an opportunity to spend some time with her recently. What has been that experience of trying to bring community health workers together to create better programs, both in Malawi and abroad?
Yeah, thank you so much. To start with, for Malawi, we have got already the Malawi network of community health workers. So this grouping has got more than 500 CHWs being gathered together. So we discuss issues on what we can be done about the CHWs. This grouping is comprising of different cadres of CHWs. We have got CHW volunteers, we have got those employed by the government, those employed by the organizations, and all those other cadres making one group, this grouping. So our vision is to have or to form a legitimate body, which is called an association. Just being a network, some of the steps are not there. We have to register. We need to develop the constitution. We need to do other things so that we can be fully recognized by the government. So just 3-4 months ago, we have just formed a steering committee, which is working on the other things. We have shared the roles and responsibilities. Some would go to other partners to find out how they can support us. Some are consulting some lawyers, and some are trying to source some funds on how we can move on. Just last week, we had a meeting with the CHIC partners. CHIC has got partners who are supporting other activities here in Malawi. So I'm privileged to be one of the members on that grouping. So we had a meeting. So I had to ask them how they are going to come in to support us as we are trying to form an association. So yeah, there are a lot of promises that are coming in. But for a start, we have got a strong steering committee, which has got a chairman, vice chairman, and those other people are supposed to take it up. Our aim is maybe to form this association before the end of this year. So globally, we are in different forums of CHWs. We have got the Speakers Bureau. We have got the other groupings which were formed by the Community Health Impact Coalition. So most of the CHWs in Malawi are also in those groupings. So we are trying to learn one or two things on how we can bring our own thing, which will be very, very legitimate and also very strong to take our voices together and advocate for the change, the positive change for our communities.
I love that. And, I've seen your work celebrated by many in a variety of different contexts. Have you experienced challenges in this work, or have you found that because there's momentum growing, a path has been cleared?
Yeah, challenges are there. For Dr. Dan, you have been in Malawi, you have served the Malawian community. The most challenging thing in Malawi is about technology. We have to communicate using platforms like these that we are doing here. But you find that most of the CHWs are in the remotest areas of Malawi. So they could not have access to maybe internet. Right now, as I'm here, the place that I stay is like a town. There's no that issues of maybe internet disruptions, but you can see we have failed to connect through Zoom. So you take somebody who is just at the deepest area, in the remotest area, it's difficult to connect using these technologies. So we want to mobilize ourselves to maybe to have a meeting, maybe to do something. We find a lot of challenges in terms of connectivity. And also issues of maybe smartphones. A lot of CHWs do not have a smartphone. You take care of a volunteer who's just working without anything. It's difficult to get that. So that's the very, very big challenge that we are facing in Malawi. The other thing is about maybe skill. Most of the CHWs, especially these volunteers, are not skilled. So they are just maybe dedicated maybe to do a certain thing, maybe the growth monitoring, but they don't have that much skill that they can do regarding to give a better service. So these are some of the few challenges that we meet here in Malawi regarding our performance as HWs in the communities.
Yeah, and it goes to show how much is really needed to build a very impactful community health worker program. In some ways, because the capacity of community health workers to contribute to health systems is in some ways unlimited. It's the limits of human capacity, which can be quite unlimited, but it does take very real inputs. You talk about technology that has a budget line item. Connectivity, that's even sometimes beyond the community health worker program, that's more in the country infrastructure. I think that here, having community health workers come together to speak with a collective voice can be very powerful because, in functioning democracies, that voice can be heard by decision makers, by policy makers, by budget makers. And that's very exciting to see. I think that we're talking about the future here. I know that there's challenges on the ground, and your tenacity and your grit to stay committed to building a better future has always been really inspirational for me. What do you hope for the future of community health? And what advice would you give our listeners who are listening right now if they wanted to support that vision?
Thank you so much. My greatest thing that I wish to be done in future is for the donors, the funders, the policymakers to prioritize CHW in the community. You know, the first thing that we should do to prevent the diseases is about to prevent. So CHWs are in the communities to do the prevention. Most of the activities done by them are preventing issues. So I would love if the governments, the policymakers, the donors, the funders uh, take their resources and put in the community for the CHWs to use them. What am I saying? If the CHWs are empowered, are supplied, are supervised, are skilled, then it means we are bringing the better services in the communities. So previously, it was all about maybe some people just attending a meeting for a CHW while the CHW is in the community, which was not proper because they would not say what is deep down in the community. So to me, I would wish if these changes are continuing, CHW should be taken to be on the table to speak. It should be a horse speaking. It should be a horse's mouth, not somebody talking about the CHW when he or she is not there. So you know, sometimes when one is not there, people maybe talk things they exaggerate some of the facts. Maybe they will not say anything that which is not there. So to me, I would wish if the CHWs are put on the table, they should explain, they should speak what they need for them to perform. They should speak what skills they need. They should speak about the type of supervision that they need. They should speak the type of supplies what they need. You know, sometimes you find that a CHW does not get the supplies, not just because the donor has not bring the things in the country, but issues of supply management. You find that locally things are not moving. If you check, you find that at the back stores, things are there. But why are not reaching the communities? Just somebody is not doing his work or her work. So the CHW should be there. They should explain. They should talk about the negative effects of doing that. So that's another thing. And also the other thing that I would wish to see it happening is the CHW to get the real skills, to be trained, adequate training. I know most of the countries do not have these adequate training to CHWs, but they have to be trained. When you are in the community, you have to know what you are doing. You have to see, you have to know that this is not the right thing and this is the right thing to do. The other thing is about payments. Most of the CHWs, even in Malawi, some are not paid. For example, right now, if we are talking about the Trump stopping the aid in other countries, some CHWs are not employed now. They're just staying. They're just doing the work as volunteers. But they have got families. They have got people who are looking on them to support. So to me, I would wish if all these CHWs, if the policies in the governments are amended so that the CHWs are paid, are compensated, are recognized, are supplied, are supervised, and are equipped with all the necessary supplies so that they work so effectively in the communities that they serve.
Amazing. And you know, a lot of times when I read people talking about community health workers, they say we use community health workers to reduce mortality, to improve adherence, to deliver services in rural areas. And that word use really captures what you're saying should not happen. That community health workers are not anonymous tools. They are human beings. And like any human being, they need inputs to thrive. And that might be supports, but it might also be salaries and new skills. And then the fact that you've been able to advocate for longer trainings to be able to do more and do it better, I think is really incredible. And of course, all of this has a budget. And the budget comparatively is small, right? I mean, compared to other things that the world spends money on, the value of improving human health with involving people in the community, from the community, is really a very high return on investment, which we know. So I think that people now recognize that we do not use community health workers, we partner with. And they'll be lucky to partner with you and your colleagues who have such a compelling voice in what this bright future should look like. Now I know we started and you said, "Oh, I have to stop at the top of the hour because I'm very busy." I want to respect that time, but I want to give you the final word. Any last things that you want to share with our listeners before we sign off?
Thank you, Dr. Dan. What I would put to the listeners is that the first thing is that uh, the CHWs are the people who work in the communities. These are the last boot to give a service at the community.
Mm,
We are the we partner much with the communities. We are so-called the community doctors because
mm.
whatsoever we bring in the community is respected and accepted. So I think the first thing that should be known to all is that if we equip the CHWs, if we provide an appropriate support, if we provide the supplies, if we train them, then it means we are bringing the right services that are needed by the communities through these CHWs. So CHWs are the people, the cornerstones of the health services across the world, and no health service can reach a community, maybe the communities without the CHWs. So we are the carriers of the messages, of the supplies, of the services, of whatsoever is needed by the communities. So we need to be respected, we need to be recognized, we need to be compensated, we need to be treated like that. So I urge all those who are listening and those funders, donors, policymakers to prioritize community health as one thing that will bring a positive change in the communities and that will save a lot of lives who would die just because there's no a community health work. So that's the last word from me. Thank you so much.
It's incredible. In this world, we need a bright spot, something to hold on to, something to guide us through this dark tunnel. And I think you've put it very clearly that this is a bright spot. And I thank you so much, Dickson, for being a leader, for being a friend. And thanks everyone for listening. Now we have our job left to do. Let's get to it.